I've had knee problems for 20-some years. I have had arthroscopic surgery done by different doctors, and it would help for a while, but it just didn't solve the problem. I went to Dr. Moore originally here at Hunterdon, who worked with me, gave me injections, gave me some exercises to do. He also had done some arthroscopic surgery on one of my knees, as well as some other areas, shoulders and so on too. I've had work done. And then when it came time for the knees really needed to be replaced, originally Dr. Moore was recommending that I go to a doctor at the University of Pennsylvania in Philadelphia. Really wasn't thrilled with the idea of traveling to Philadelphia back and forth and all, and I just didn't like that. So I held off for a little while. And then about a year and a half ago, I guess, he told me that Dr. Glassner was coming into the practice and that he had the training and all to do what needed to be done on my knees. And it's worked out very well. Quality of life was very bad. I really couldn't walk well at all for very long. When I did, I had to use canes or crutches for the most part. I was even down to the point of using a rolling walker, rollator or something they call them. You sit down and all like that. I was using that up near the end of it, and I couldn't stand for more than maybe 5 minutes at a time. Pain was really bad. It actually had gotten to the point where my leg, especially my left leg, was turning out and bending out to the side, and you just couldn't get upstairs well. Very, very difficult maneuvering. So we did the left knee, and it really amazed me just how much it straightened out. You know, the first thing I got, and I could look and say, wow, it's actually going straight. It's not going off to the southeast here. And so I was up on that in the hospital that night. It was a little discomfort, obviously, but the pain inside wasn't there, and I could actually stand up, and I felt, you know, strong again. And then we had so after I recovered from that surgery and all, and I was doing quite well, but again, I was still using a cane to get around and all because the right knee still was in bad shape. So that was this past August in 2011, we had the right knee done, and that went even better. I recovered quicker out of that. In fact, I think it was like I was 2 to 3 weeks faster recovering than I was with the left knee. Did a lot of therapy, and using the Hunterdon therapy at Clinton, and they've been doing a great job on it. I'm still going there for some recovery on it, some strengthening of the quad muscles and so on, and it's coming along really very, very well. I can walk now. I can actually take the dogs out for a walk, which I have never been able to do. I can, last week the weather was so nice and all, I was actually cutting brush around the yard and hauling out limbs and so on like that, and felt fine, really, really good.